Hello friends, I hope you all are doing well. So I am discussing the stages of labor. In my previous lecture I discussed about the first stage of labor, and in today's lecture I'll discuss about the second stage of labor. So second stage of labor, it starts from the full dilatation of cervix, that is 10 centimeter, till the delivery of the baby. So this stage is basically concerned with the descent, that is a downward movement of the fetus, and the delivery of the baby through birth canal. So next is the timing. The timing of second stage of labor in primary gravida is 2 hours, and in case of multipara it is 30 minutes. Means it takes 30 minutes from the full dilatation of cervix till the delivery of the baby. So under second stage of labor we cover 3 things, that is the events which takes place during the second stage of labor, the clinical course, that is the sign and symptoms, and the management of second stage of labor. So under events there are 2 phases. First one is propulsive and second one is expulsive. So propulsive phase is usually starts from the full dilatation of cervix, that is of 10 centimeter, until head touches the pelvic floor, means the bottom of pelvis, and then the expulsive phase starts when there is a bear down efforts and the push by the mother until the baby delivered. So that is known as expulsive phase. We will discuss about the bear down efforts in detail. Firstly, we will go with the events which takes place during the second stage of labor. It consists of 2 phases. First one is propulsive and next one is expulsive. So under propulsive phase, when there is a full dilatation of cervix, the membranes ruptured. Means when the cervix is dilated at 10 centimeter, the membranes ruptured, and when the membranes ruptured, there is a release or escaping of amniotic fluid from the ruptured membranes, which leads to decrease in volume of uterine cavity. Decrease in volume means the inside space or the space inside the uterine cavity decreases as the amniotic fluid released, and simultaneously there is increase in contraction and retraction. Means when the volume is decreased due to the releasing of amniotic fluid, side by side there is an increase in contraction and retraction. So due to the contractions in the circular muscles of the uterus, the transverse diameter of the uterus is decreased while it appears more elongated as the transverse diameter is decreases. This happens so that the fetal axis remain straight. So after this, next is an expulsive phase. Under this there will be a uterine contractions and voluntary contractions by the abdomen. Means there is a voluntary pushing by the mother in order to expel the fetus for the expulsion of fetus. So with the help of uterine contraction, that is the expulsive involuntary uterine contractions added with the voluntary contractions by the abdomen, results in expulsion of fetus or the birth of the baby. After overcoming the pressure of lower uterine segment, as we know, when there is a uterine contractions or the bear down efforts by the mother which pushes the baby downward or which helps in descent of the baby, there is a slight or there is a pressure from the lower uterine segment which pushes the baby again backwards into the uterus. So this actually happens when there is relaxation period, means in between the contractions. So descent occurs when there is a contraction. When the contraction passes off means when there is a relaxation, then the upward movement is taking place because of the pressure exerted by the lower uterine segment because of elastic recoil. So the meaning of elastic recoil is coming back to normal position after the stretching. Okay, so when there is a relaxation, the lower uterine segment muscles try to coming back into their normal position after the stretching. So due to this, there may be the backward pushing of the baby, which actually prevents by the retraction. As we know that there is a permanent shortening of muscles in the upper uterine segment. Even when the contraction passes, the muscles remain contracted. That is a permanent shortening of the muscles which prevents the backward push of the baby. So when there is a uterine contractions and voluntary contractions which overcome the pressure exerted by the lower uterine segment, results in the expulsion of or the birth of the baby. Here in the diagram, when mother push the baby downwards, there is a rising of contractions in the abdominal area, like voluntary abdominal contractions because of the maternal push or when mother exerts the pressure. And there is also the uterine contractions inside the uterus, which results in expulsion of fetus by overcoming the pressure exerted by the lower uterine segment due to the elastic recoil. So the voluntary abdominal contractions by the maternal push is known as bearing down efforts. Bearing down efforts are basically the mother's push. As here is written, showing the expulsive forces in the second stage which increase the intra-abdominal pressure. So the intra-abdominal pressure is increased when the mother exerts voluntary pressure. Augments means increase the downward expulsive force of uterine contraction. So that's all about the second stage events. Okay, so after events, now we will go with the clinical course or the sign and symptoms which usually occurs during the second stage of labor. So the first clinical course is pain. So pain occurs because the duration, frequency and the intensity of pain is increases as the uterine contraction occurs every 2 to 3 minutes and it will remain there for 1 or 1.5 minutes. As in the first stage of labor, the uterine contraction usually occurs after 3 to 5 minutes and the duration of contractions is 45 minutes. But in second stage of labor, the frequency is 2 to 3 minutes and the duration is 1 or 1.5 minute, and it becomes successive, means the uterine contractions come one after another and it comes at regular interval. So next is bearing down efforts, which I already explained, but here I give more details about the bearing down efforts, that how it started in second stage of labor. It is basically occurs because of nerve reflexes, which is known as Ferguson's reflex, which I think already discussed in my first video. So under the Ferguson's reflex, when there is a dilatation of lower uterine segment or when there is a pressure on the cervix, means when there is a dilatation of cervix or the lower uterine segment, it stimulates the hypothalamus and hypothalamus stimulates the posterior maternal pituitary which stimulates the, which actually produces the oxytocin, which is basically helps in the uterine contractions, but it also believes that it helps to establish the maternal behavior. So with this, the mother has a strong urge, and the irresistible means which she cannot avoid. So she has an irresistible urge to exert pressure or to push the baby, okay, to expel the baby, okay. So when there is a dilatation of cervix, there is a stimulation of hypothalamus, which stimulate the posterior maternal pituitary gland, which in results produce the oxytocin, which is believed to establish the maternal behavior, which is results in irresistible urge in the mother to push the baby, which is known as, this thing is known as bearing down efforts. So the bearing down efforts encourage the mother to push only when there is a contractions. There will be no any pushing during the relaxation period. So the pushing is only allowed when there is a contraction. Means we should have to instruct the mother that don't push the baby or don't exert the pressure when there is no contraction. So the next clinical course is, or the next sign and symptom is status of membranes. So the membranes ruptured after the full dilatation of cervix, but sometimes the membranes do not rupture and baby delivered inside the membranes, which is known as birth in caul, or born in caul. So in that case, membranes do not rupture, but the baby is delivered with membranes over the baby. So that is known as birth born in caul. So the membranes usually, means normally it ruptured when there is a full dilatation of cervix. And another clinical course is descent of fetus. So the descent of the fetus is checked abdominally or the vagina, or through vagina, or through the vaginal examination. So in case of vaginal examination, we can note the station of head by inserting the fingers through the ischial spines. So we are noting basically the station of head. Okay, so in case of abdominal examination, basically the abdominal grips has been done to find the station of head. So the question arises here, what is the engagement of presenting part or the engagement of head, which is normally a presenting part, is when the widest part of the head enters into the pelvic brim, as this is a pelvic brim. So when the widest part enters into the pelvic brim is known as engagement. So after the descent of fetus, the next clinical symptom is include vagina, that is The vulva is look like a slit, that is the long narrow opening with the visible hairs like here. So due to the contractions, the perineum distended or stretched, because of which the skin looks glistening or the skin look shiny. The meaning of glistening is shiny, and it appears circular like in crowning. When there is a crowning, means the biparietal diameter of the head stretches the vulval outlet, and there is no residing back of the fetus even when the contraction is passes off. That is known as crowning. So next are the maternal signs and the fetal signs. So firstly, in the maternal signs, the respiration is decreases, but the perspiration means the sweating due to the bearing down effort is increases, and due to the bearing down efforts the mother is exhausted. And the face of mother become congested due to the increased blood supply, and the neck veins become prominent, means it looks visible because of the increased blood supply. So that's all about the maternal signs. Next, in the fetal signs, the fetal heart rate usually decreases when there is a contraction, but it becomes normal when the contraction passes off. So that's all about the clinical course during the second stage of labor. Next, we will move towards the management. So in the management, there are three types of management. There is medical management, surgical management, and the nursing management. So in the medical management, there are two types: pharmacological management and the non-pharmacological management. So in the pharmacological management, pain relievers, that is oxygen and nitrous oxide, may be given in the form of gas in order to relieve the pain. Next is uterine contractors may be given during the second stage of labor in order to increase the contractions. There is oxytocin and prostaglandin. In case of non-pharmacological management, nurse must use the aseptic techniques, that is follow the 3 C's, that is clean hands, clean surface, and clean cutting and ligatoring of the cord, means clamping of the cord. Next is preparation for the delivery. A coach's scrub up, means a coacher is a person who helps in the delivery in order to prevent the infection. And after preparation, there is a delivery of head first, and then there is a delivery of shoulder, then there is a delivery of trunk. And after delivery, there should be cutting and ligatoring of cord properly, and care of newborn baby, that is care of eyes, care of cord, and the passage of meconium should be checked, care of the skin of the baby. And next, in case of surgical management, episiotomy may be done, that is basically a surgical incision on the perineum in order to facilitate the expulsion of the fetus. This is primarily done in the, or this is mostly done in the case of primary gravida. And next is the nursing management, and here you can make the diagnosis, especially that is according to the priority. First one is risk of infection. As there is the more risk of infection, because during the second stage of labor there is a risk that mother can pass the stools. Okay, so on the pain you can make it, and impaired eliminatory pattern, impaired fluid and electrolyte balance, anxiety, so on. So the nursing management you can do according to the marks. If there is an 8 marks question, then you should have to explain at least 5 nursing diagnosis. So if it is in 5 marks, you can explain 2 or 3, but you can frame at least 5 diagnoses. So that's all about the management of the second stage of labor. So in today's lecture, we discussed about the second stage of labor, its events, clinical course and management.